Hi, I'm here with Alicia Taylor, who's in St. John's, Newfoundland. And Alicia is a clinical, she's a PhD candidate, and her background is in clinical epidemiology. And Alicia actually is the author of a recent publication, and the publication I actually have right in front of me. And if it's okay, we'll add it as a link at the end of this so people can continue to have a good read about it. And it's called Infant Feeding Mode predicts the cost of healthcare services in one region in Canada, a data linkage pilot project. Now, when I read this, I thought, wow, I know we'd done some similar research in Quebec many years ago. And, and I thought, it's so important for us to be discussing how infants are fed and what the impact is on long-term outcomes, but particularly with COVID in place right now and our healthcare all over the place, it's so important that we actually are looking at the cost and the value of what we're doing. So, but before we start there, do you want to give me a little bit of a background of where your interest in research in infant feeding came from?
It's funny, actually. My interest stems from my sister. So my sister had her first child in 2015. And when she started breastfeeding, it was a totally new realm for all of us. And, the trials and tribulations that came with that and learning about it. And it was just around the same time in 2016, I started my program at Memorial University in clinical epidemiology. And I connected with Dr. Lori Twells, and she is an extensive researcher in infant nutrition in Newfoundland and Labrador. And we connected, and she asked if I would be interested in coming to a few of the meetings with the Baby Friendly Council of Newfoundland and Labrador and the Breastfeeding Research Working Group. I attended these meetings, and the interdisciplinary team that I was going to get to be a part of if I wanted, everything was just falling together. I got to learn so much more, and I felt like I was able to connect with my sister with this education piece, with stuff I was learning about it. By 2017, she had her second child, and then she had the opportunity of breastfeeding them both. So then that was, exactly. Yes. It was this beautiful relationship or knowledge that I didn't even know existed. So I was able to see her breastfeed a 2-year-old and then breastfeed a newborn. And I was enthralled by it. And then when I started working with this group and learning about all the research that they were doing and all the different members that they had join this, it's an interdisciplinary team, and they've been meeting for the last 10 years or longer than that, really.
Yeah.
And the members of this team are senior health researchers, data analysts, policymakers, decision makers, and students. And when we could connect and I could learn more about infant nutrition and breastfeeding and what's done in the province, I was just speechless. I said to them, sign me up, please.
And drawn in.
Exactly. I was like, I want to be a part of the team. How can I be a part of this world? And since then, it's been a beautiful relationship.
That is incredible. And I know throughout Canada, we just are amazed at the work that's being done in Newfoundland and Labrador and their baby friendly that program that's in place. And it really draws your community. I love the drawing of the community. It really is one of those most amazing groups. And the videos that are made within the community that are shared around the world in reality, because I know I share them. I just love where it's came from. So it's in the depth of your program, which is really important. And I think
exactly.
So you've come from there. So if I'm looking at from that step, so my next question was, how did you get involved in this study in reality on the infant feeding modes and predicting the costs of the healthcare services? So obviously it's come from the background that grew from there. But what drew to specifically now looking at the costs?
Yeah, when I started, I connected with Dr. Lori Twells and also Dr. Leanne Allwood-Newhook. So both of them actually co-chair the Breastfeeding Research Working Group, and they have done several studies together and lots of research. And when I started as a student, we had connected about how I could potentially start doing some literature reviews and looking into what's done in Canada and internationally on healthcare service use. So just looking at healthcare outcomes and infant feeding and what that association was and what people were actually studying. And when I started looking at that and looking at the actual relationship with infant feeding and healthcare, I was able to see that some people were starting to research costing studies. And so not only were they looking at hospitalizations and emergency room visits and physician claims and those kinds of things, they then actually were able to put some figures to those actual visits, and they were able to look at some costs. So when we started to put together my supervisory committee, we actually had a new health economist start at Memorial University, and his name is Dr. Heinugen. So as soon as he came, we knew that we were going to be set. We would be able to have a health economist on the team. We knew we wanted to look at some healthcare outcomes and attach those costs associated to that. So then once we put the team together, then we kind of ran with it.
That's amazing. I've got a friend and colleague in Australia who's a health economist, specifically gearing her work. It's Julie Smith, who works.
Oh my goodness! I have read all of Julie.
Yes. So Julie's amazing. Familiar. Yes, with the work that she does, and that's been a very long time that she's been researching this. So when you did the study, what actually did you find as the results from the work that you've done?
In my particular study, we actually looked at a fairly small sample. So we looked at 160 infants. We looked at those that were healthy full term in the Eastern Health region of Newfoundland and Labrador. And even with looking at 160 infants and comparing across them, looking at exclusive breastfeeding to 1 month, mixed feeding, and formula feeding, we were still able to see differences in the costs associated with the total healthcare service use in the first year of life. So what we looked at was looking at the hospitalizations that took place, specialist visits, visits to their general practitioners, and emergency room visits. And when we combined the cost of all of those, we still were able to see some differences. So we called this a pilot study because what we wanted to do was frame it as, we knew we had a smaller sample. We knew we had an exposure that wasn't as long as we wanted. So we wanted to see, with even this small of a number, were we able to actually detect any differences? And from that we were. So we were powered enough to see a difference, and with that we saw one. So now what we want to do is actually move forward with a larger provincial study looking at all of the births across Newfoundland and Labrador for a number of years. And then that way we would have a much larger sample and a longer exposure period. So then we can see if infants are breastfed to 6 months, what are the differences that we're going to see when looking at, exclusively breastfed, mixed fed, formula fed, and that kind of thing. But it was astounding to us how you could see, even at a comparison level of just 1 month of exclusive breastfeeding, we could see some differences, and we could see higher costs related to those that were mixed fed and related to those that were formula fed. So when you look at it that way, you realize that if we just could have a few more resources, if we could just have a little more education, if we had more things in place that could increase our numbers for exclusivity and also duration, look at the health outcomes that we could improve, but also look at the costs associated with that and the cost savings that we could potentially have.
And I always look at it, I've always had this dream of having something where when we work with research, is actually having a stream of preventative medicine, because we can't ever change completely something, but at least when you study something, if you could take a stream of following family prenatally all through, and having a preventative medicine approach, and then looking at what we consider a normal stream, and having a look 10 years down the road, having a look 15 years down the road, in these long-term outcomes, that we could have so much potential. And I think we've really got to be able to be aware of how it's got nothing to do with this, the process that comes back is that, you can't make people feel that they've got to be forced to breastfeed. It's got nothing to do with that, because we know the majority of people want to breastfeed.
Yes, and the desire is there.
The missing is the support. When we talk about, this is World Breastfeeding Week we're in right now, and we talk about the protection, promotion, and support of breastfeeding, and every time we forget about the support. And it's sometimes even as simple as a quick phone call, text messages from people saying, you're doing great. Having a hotline to sort of just to let somebody express themselves. They're not costly when you look at the long-term outcomes.
Yeah. And I think now more than ever, people are seeing that even connecting through social media.
Yes.
As long as you know that what you're experiencing is normal, and that you might have some difficulties at first, or that who should you connect with if you have questions about particularities of breastfeeding, or, you know, moving forward with your journey, what are your resources and how can you actually get to those? And it doesn't necessarily have to be that one-on-one visit. Maybe it is just a phone call, or feeling connected, or feeling like you can relate to somebody else, or that middle of the night, you're awake, you're feeling frustrated, you're tired, there's a million things happening, and you can just hop online and you can chat with someone, and you know you have someone else on another side of the world who's also up in the middle of the night, and you know it's universal, and that everyone at some point feels this way, and that kind of thing. I think the support piece is so huge, because we can look at our initiation rates across Canada. We know people want to breastfeed. Exactly. And then from there we have this huge drop off. So where are we missing in the picture, that we start with this high initiation rate, and then you look at even up to 6 months, you know, it's so much smaller, and you know, people desire to want to continue and feel like they can't, and it's meeting them and knowing that there are things that we can do to stay connected with them and ensure that they feel supported on this journey, and know that it is a journey. It's not, you know, it's a learning curve for both baby and mom, and moving forward with that, I think staying connected with them and supporting them is huge.
It's crucial. I agree. So if you I love what you've said here. Now, if you could give a message to governments of the world, what would it be? You know, what you've researched, what would it be that you would want to share with them so that we can make a difference?
I think exactly what you said about preventative medicine. Governments need to know that investing in breastfeeding is an investment in preventative medicine. They need to know all of the short-term and long-term impacts that increasing breastfeeding rates and its duration can actually have for health outcomes and for costs. Oftentimes, policymakers and decision makers in government, they need to worry about budgets. They need to worry about costs. And that was the biggest part for us moving forward with these studies, was saying, you know what, we might actually have the potential to give them a number that then they can see it as a cost savings. You know, potentially if we invest in more things for moms, we can move the money around that way. And then that way, instead of spending it on all of the different, the visits and the specialists and the emergency room and the hospitalizations, we can actually spend it on supporting them so that we don't get to the negative health outcomes that might come from a shorter duration of breastfeeding. I think the biggest thing that they need to take home is that investing in breastfeeding is investing in our future. There is so much for breastfeeding for infants and for mothers and families and communities. And the research that is done worldwide will show you so many different pictures of each of those components. And they can know that there is potential there for so much for our entire world. It's not just for babies. It's not just for moms. It's for everybody. And they need to invest in it.
Thank you so much. I really appreciate it. We got the same message. It's been really great.
We've got it all figured out.
We just now have to get our politicians to make a difference there. And I think it will come. I think families are ready for this also. And I think the community across the board, you know, we have to invest in our future. You know, and we have to make a difference. And it has to touch everybody. And I think we forget that the investment in breastfeeding is actually probably one of the most valuable things and cost-saving things any government can ever do. But it's so often just put on the back burner, and it's just it's considered something. Well, it's a nice thing to do, but it's actually an essential part of healthcare, and we really need to get in that direction. So thank you so much. I really appreciate having have a great chat with you today. It's been wonderful.
Thank you. I feel so lucky to be here. Thanks.
Thanks.